If people are able to comment, if you can comment if you can hear us, that would be lovely, just so we make sure we're not talking to ourselves.
If people are able to comment, if you can comment if you can hear us, that would be lovely.
Oh yeah, I think we're good. Got one person. We'll just give it a few more seconds. 5 viewers. Okay. 9. Okay.
Very good. Okay.
So my name is Zoe, one of the Chipping Norton Midwives, so you might recognise our faces. We've done this before a couple of times.
And I'm Fiona. I'm a midwife based here at Chipping Norton as well. We're going to talk about postnatal care today and how to sort of optimise your recovery after you have a baby, and talk about some of the things you go through as new parents, and also what your baby's going through as well, and how to deal with it a little bit. Please ask some questions. I've got my phone here as well. I'll keep looking to see if people ask questions while we're doing it, okay? And we'll try and answer them as we go along. All right.
So we just thought we'd start off by talking about actually what to expect in terms of when you will be seen by a community midwife throughout your postnatal journey. So obviously everyone's kind of postnatal care will look slightly different depending on the kind of birth you've had and your individual needs. But we thought we'd show you, so this is what you will go home with. If you are birthing anywhere that is not your home, then you'll go home with this, and if you give birth at home, we bring one of these to you to leave with you. So your blue notes, which you've been attached to throughout your whole pregnancy, are then taken away and go into storage. So it's just this that you're going home with, as well as a little red book, which is basically your child's health record, your baby's health record. So that's everything. So this is what we call your postnatal care plan. So it's where we write important information when we come and do your checks postnatally at home. And there's also useful information in here for you as well. So people often think that they can't, they don't have a read through it and see what's in there, but actually there's lots of useful information in there as well. And you get a little pack with some useful leaflets too. So that's paperwork. So in terms of when to expect to see us, we always come and see people ideally at home, if our staffing allows, the first day after you get back from wherever you have given birth. So we automatically get a notification to say that you've had your baby and that you're going home, and we will then get in touch with you to arrange a time to come and visit you. So that's what we call your first visit. And then kind of your bare minimum routine postnatal care, we then usually see people again on about day 5, and then again on day 10. So that's your routine, but we will always be happy to see people as much as needed if they need support for anything. And we really encourage women to just pick up the phone and call for help if you feel like you do need support with anything. We kind of presume if we don't hear from you often that you're doing well, so it's really important that you ask for help if you need it, which we'll go into more today. It's sometimes, depending on kind of the team you come under and capacity and what staffing's like, some visits for day 5 and day 10 are done at home. Sometimes we invite you into one of our kind of base units depending on how you're feeling and whether that's possible for you. So it kind of varies depending on the situation. So that's kind of a brief overview of that.
Mm-hmm. Yeah. I just realised we didn't mention this. You're probably wondering what on earth are they doing there. This is something we used in antenatal classes to talk about sort of postnatal care and what to expect. Because, as you can see, this is actually Will and Kate when they had their first baby. So it's a bit dated. But they look really happy, don't they? I think that's the photo they took, like when they were leaving the hospital or whatever. And she looks $1 million, doesn't she? Like she hasn't been through a massive big thing at all. And it is just to remind people that actually there is a lot going on when you've just had a baby, physically and mentally as well for both parents. So it's okay not to look like that when you leave the hospital or wherever you've had your baby. So we'll just talk about some of the different things that's going on with all these people. So the mother, partner and the baby. we'll do it in sections. Who should we start with? Mum?
Well, yeah.
Okay.
Yeah.
So, we've got a few words here. We've got
Yeah.
sore.
Hopefully you can read that.
Yeah. Where shall I stick this?
Well, I reckon, shall we go around up here?
Okay.
A few areas we could put it.
Yeah.
Perfect. So that leads us on nicely to talking about stitches and whether you may have had them or not. It's quite normal to feel a little uncomfortable and sore in the vaginal area and perineal area after having a baby. So the stitches that we use in Oxfordshire are dissolvable, so there's no need to come and have them removed at all. It's something that's community midwives, we can check them if you would like them to be looked at in terms of recovery. Otherwise we don't need to. We usually ask when we come and see you. But it is very normal to feel quite sore and uncomfortable, particularly in the first kind of few days initially after going home, and that will vary from person to person. So hopefully before you go home someone will talk to you about perineal care. So what we want to talk to you today about is that yes, although there's these things going on, there are things that you can do to help with your recovery. So hopefully you should go home with some information and an information leaflet, which hopefully we've got all on here, talking about. Oh, possibly not. Oh no, there we go. Perfect. So care of the perineum after having a baby. So this is basically your guide on how to look after your stitches, how to keep them clean and dry and optimise their healing. But essentially it's a lot of common sense, so a lot about basic hygiene, changing your pad regularly even if you don't particularly need to, but changing it every few hours just to reduce the likelihood of any kind of bacteria build-up that may cause an infection. Being quite good with hand hygiene, so if you remember to wash your hands before you go to the toilet as well as afterwards, again, so you're just reducing the likelihood of introducing any potentially harmful bacteria. We say ideally when you're washing, just warm water, no kind of shower gels or creams or anything like that, just warm water is all you need to keep your stitches clean. There are lots of kind of products you can buy these days. I think Spritzer Bits is one of the most popular ones. So kind of sprays that you can put on your pad to aid in recovery, which have a lot of kind of natural properties in, things like lavender, which has been shown to potentially encourage healing, but you don't need to use them, so it's fine too, as long as they're not causing you any irritation. But really you just need kind of warm water, either in the shower, and it's fine to have a bath as well. That's absolutely fine. People worry about that, but you're not going to do any harm. Again, just nothing in the bath unless you wanted to put a little bit of lavender oil in, something like that, but otherwise just warm water. Signs of an infection that we ask women to look out for and let us know is if kind of quite quickly or suddenly the stitches are getting more sore, more uncomfortable, and often we notice people kind of sitting down, it's obvious it's quite uncomfortable for them, or when they're walking it's really quite uncomfortable. So we would like you to let us know if you are concerned rather than waiting till your next checkup. Or if you notice any kind of unusual smell or discharge that isn't normal for you, or just felt unwell, like you had a bit of infection, so you felt like you had a temperature, or your heart rate has gone up a bit. And we do try and encourage people, if they feel happy, to have a look at their stitches as well, and it's really important that you understand what's actually happened with your body. I think lots of people can feel a little bit disconnected from that part of their body, and they don't quite understand what's happened, but actually most people feel better about it if they do know. So it might sound a bit silly, but you can ask your midwife to even kind of draw you a diagram if you'd like at birth, so you actually understand what's been done and where the stitches have been put in. And then by looking as well, looking yourself, you'll be able to kind of have an idea as to whether they've changed, anything's changed from day to day, and anything you might be worried about, so that you can let us know. Anything else with stitches?
Even without stitches, not everybody needs stitches or has a little tear, although it is rather common. But if you have a vaginal birth and a baby's come out of there, it's likely to be sore in some way. You know, you can just be bruised and things like that, which isn't lovely either, but does get better. So most people, if you haven't got any intolerances or haven't got asthma or something like that, can take ibuprofen. So ibuprofen's fine, even when you're breastfeeding. So we know you can't take it when you're pregnant, but you can afterwards. And because you haven't taken it for a while, it's really helpful again as well. But that's what really helps with inflammation, and that area can be. And most people can take paracetamol. So those together will sort of help with the down below area and any soreness. Do you agree?
Yeah, definitely.
Did you want to talk about perineal massage now, because it's linked?
Yeah, I do. Have we got the leaflet for that one?
Yeah. So this is about what we can actually do to try and prevent or minimise tearing in the first place. So do ask your midwife to give you this leaflet if you haven't already, nearing the end of your pregnancy.
It talks about, you may or may not have heard of perineal massage. There's probably a lot on the internet these days about it, but yeah, this leaflet's really helpful. So essentially it is as it sounds. It is something that you can do yourself or ask your partner to do, but it's massaging the perineal area, so it's kind of the space between the vagina and the anus really that does the stretching as your baby is born. So there has been lots of research to show that by massaging that area in pregnancy from about 35 weeks onwards, you are less likely to have more kind of significant tears and need for stitches after birth. So it's not reducing the likelihood of it happening at all, but it's certainly something you can do to help to minimise needing to have that done. It's not for everyone. Some people find it a little bit too uncomfortable and they don't want to do it, and that's absolutely fine, but it is worth reading into and having a look. So there's some good research behind it, and this leaflet kind of explains how to do it safely, what oils to use to do it, and what to expect when you are doing it. And it's essentially about encouraging the skin and the muscle and those tissues to be able to stretch more easily, and it also can encourage blood flow and just get you used to that kind of stretchy feeling as well. So yeah, good. If we're talking about optimising postnatal recovery, it's kind of like doing your homework before birth, basically. Kind of think of it that way. So yeah, that's perineal massage.
Yeah. I've actually got the word sore again, because we'll put it somewhere else this time to include all types of birth. Yeah. Yes, it's working the sellotape. So this is a bit higher up. So this is the lower abdomen there. Okay, so that represents a wound if you have a caesarean birth, which is, have I put it in a good place?
It's hard to tell because of the blanket. It's fine.
So some women will plan to have a caesarean if they've had a previous or for other reasons, or some people have an unplanned caesarean, but it's both the same, and at the moment what they're doing is having stitches that don't need to be removed, so they're dissolvable as well, aren't they?
We used to remove them and now we don't have to.
Yeah.
Right? Yeah.
So we used to take those stitches out in the community, but now we don't need to. They dissolve on their own, and we just keep checking them and making sure everything's healing well and everything. So they are covered up to begin with a dressing, which we're used to seeing them off by the time they come out, by the time we come and visit you at home, although sometimes they are still on there, in which case I try and encourage the woman to let us have it off or take it off herself so that some air can get to it with healing and everything. Do you do the same?
Yeah. And often if people are a bit nervous about us removing it, sometimes a good way is when they have a shower and get the dressing a little bit wet, it can peel off a little bit easier, so the warm water can help. But yeah, I think kind of by 48 hours usually we would encourage women to take the dressing off, get some air to the wound.
So we're checking that it's clean and healthy and drying out okay. Women are always shocked, aren't they? I find when we say to take the dressing off, because they think it's like helping hold it together. It's not. That's all done really well inside with all the internal stitching and everything, and they do heal very easily on their own. They sometimes they can get infected too. That's what we're looking out for, you know, so any oozing or redness. We'd like to know any sort of bleeding as well that there was on your dressing. We'd like to sort of check it and everything. But on the whole, they heal really well. It is a big operation having a cesarean, so it's another thing that there will be discomfort with. So yet again, paracetamol and ibuprofen. Some women actually leave hospital with heavier pain relief than that if need be. Some people just take longer to heal from it and are in more pain. We're all different, and some people, you know, get on with it quite well, but your body has been through quite a lot, so we do want you to sort of relax and recover and not be out walking dogs and things like that, which some people feel like they are up for, but I have to tell these women to take it easy.
Yeah. If you're a person that's used to being on the go all the time, it feels unnatural to be sat on your sofa enjoying cuddles and feeding your baby. It can be hard to slow down, but yeah, absolutely. And similar signs for infection with a cesarean wound, if it suddenly got a lot more painful or there was lots of kind of oozing and discharge or a horrible smell or just, and anything unusual that looks like it's changed when you have a look at it. Bruising's quite normal around a cesarean wound, have a little bit of bruising on the skin around it, so that's normally not to cause of concern, but if you notice it and it is worrying you, of course, contact your midwives. I think that's...
Yes.
Oh, and same again, just no creams, nothing, just warm water when you have a shower. And it can be quite good before you put clothes on as well, maybe just have a few minutes, kind of let some air to it after a shower, just you're trying to avoid a kind of moist, damp environment before you put underwear and clothes over the top, because that will also help to hopefully prevent infection too, get lots of air to it. Yeah. Loose clothing is good as well for afterwards, comfy clothing.
Good. Should we talk about bleeding? Because no matter what sort of birth you have, there will be bleeding postnatally. It's got its own stickiness to it. Stick it there. There you go. So, as we said in our last Facebook Live, I'm scared of repeating myself in case people watched it before, but everybody bleeds after birth. That placenta has moved away from your uterine wall and therefore sort of exposing an area which all needs to sort of be knitted back up and scrunched back down to be completely not an open wound anymore. So everybody's supposed to bleed, and it can last up to 6 weeks. That's sort of the span of normality, although it doesn't usually last that long, I would say. So you'll be having lots of using lots of sanitary towels and pads. Maternity pads are the best. They're very thick, and because the bleeding can be quite heavy to begin with, more so than a period in the first 24 hours. You'll need to sort of change it at least every 2 hours in the first day, and then it starts to sort of slow down, we find. But changing it regularly will reduce the risk of infection. And as the days goes on, we always ask, what's your bleeding doing? Is there any clots? How often are you having to change it? It does start to reduce. Can go up a bit more if you're a bit busier in the daytime. Also, because breastfeeding releases oxytocin, it makes your uterus clamp down. That can make you sort of bleed more. So if you're sat feeding and having a bit of a feeding session, you might find that the flow increases for a little while, but that's supposed to happen. It's a physiological process, and that's okay.
So what we're asking women to look out for, so we ask you these questions when we come and see you, but as a rough guide, what we would class as maybe bleeding being slightly too heavy that we want to know about is if you are kind of soaking through your pad every 1 to 2 hours and having to change it that often. It may still be absolutely fine, but we just would like to hear from you so we can come and see you and have a feel of your tummy and do some other checks, really. Or if you were kind of continually passing some larger clots. So some smaller ones, as a rough guide, kind of less than a 50p piece, we're generally not too concerned about, but if you were to pass anything bigger than that, again, it's probably fine, but we would like you to let us know, basically. But have we got any questions?
about what we're talking about at the moment, and there's one I'd like to come to after this video's come. So I will answer your question, Rachel. But as it's off topic, I'll come back to it.
We will definitely answer them at some point.
Okay. Another joyous subject. Cracked, I've got here. So this is also going to go on Kate's boob. There we go. So talking about sore or cracked nipples happens very often, and what we want you to do is get breastfeeding help. Breastfeeding shouldn't be sore, although for many it is, while you're sort of learning and trying to get it right between you and your baby. It's a new skill and everything, so it certainly doesn't mean you're doing anything wrong as such. It's just that we can probably help you to ensure that it carries on getting better, your breastfeeding relationship. It's usually a little tweak that we can help you with in order to make sure baby goes on deeper and stops making your nipples so sore. That's the best cure for cracked nipples. However, sort of short-term things that can relieve the symptoms, although it's not going to make it better without perfecting your breastfeeding. There are different sort of creams and things like that you can get. I always say to people to put some nipple cream in the middle of their breast pad when they put it in their breast, so that if it's cracked, when you pull it away, it doesn't attach to anything and make it sorer. What little tips have you got?
Yeah, I mean, mostly that. There's just in case people have seen them on the market. People do seem to be using these kind of like silver cups. Have you seen them? Those like with silver nipple covers, and I'm not quite sure. Just in case anyone had any questions as to how effective they are, but some women do swear by them. Apparently the silver in them seems to have some healing properties, and lots of women do swear by them, so that's something else. Okay. Or the super old school cabbage leaves. Some people do find, again, not too sure on the research front, cream is probably best, but some people, you might have kind of older generations suggesting cabbage leaves for sore boobs. Mm-hmm. Whilst we're on that topic, so I was just going to talk about when your breasts feel quite full, when your milk comes in. Which is really, really normal, but sometimes they can feel quite tender and a little bit sore just to touch, so not just on the nipples, and things that can really help with that's like a warm compress. So just a flannel, any kind of cloth that you can get nice and warm, and some warm water, and using that on your breasts will often relieve that tenderness a little bit. Or a little bit of massage, so particularly in the shower as well, when your breasts are naturally warm, just like using either kind of your fists, like a kneading kind of motion, or just the palm of your hand, and do some massaging motions on your breasts, particularly on the side. It does just help if there are any kind of milk ducts that are a little bit blocked, or everything's just quite full. It kind of helps to push everything through and ease that tenderness, and usually it sort of settles back down, but initially you kind of have this like overproduction because your body doesn't quite know how many babies it needs to provide for and how much milk to produce, and then as the kind of supply and demand starts to kick in, it tends to settle down. But yeah, just something to be aware of. You could try those things, massage and a warm compress if needed. Anything else on the breast-related subjects? I think so. No, that's a lot that's probably been covered in the breastfeeding video.
Yeah.
Sure.
Okay, moving on.
Yet another subject.
So this one is constipated. So it's something we see quite a lot of.
Yeah, very, very normal after having a baby.
Yeah. It's something we look obsessed with because we always ask about people's bowels and their ability to pass urine as well. It just seems to often slow it down for people having a baby, whether it's that they're not eating as they normally would because they're so busy, or they had a little clear out before they had a baby.
Your digestive system just sort of not shuts down, but kind of, isn't quite working as it usually would in labour because your body's focusing on using energy elsewhere, so it takes a while to kind of kickstart again almost.
Yes. So it's something we ask you at our postnatal checks. Have you opened your bowels yet? And when people say yes, I always say congratulations, actually, because it can be quite a big deal. So it can be quite hard work, and some people do you need to see the GP for a bit of help with maybe lactulose or something like that to help it pass. It doesn't always it come to that at all. Sometimes you just don't need one, and that's okay. And it might be normal for you to go a few days, but it's just to be aware. Some people pre-plan when they know what it's like if they've had previous babies or whatever. Some people do get some stool softeners in and things like that. But also you can think about your diet and what's going to help there, and fibre and fruit and vegetables, drinking plenty of water as well. So with passing urine as well, we ask about that. It shouldn't sting, or we want to know about it if it hurts or if you have any signs of infection. Doesn't necessarily mean that you have got an infection if it's not working completely as normal, if there is a bit of pain and stuff. Depending on what happened in labour and things, or if there was a catheter involved, things like that. Sometimes it can be more normal to have pain, but we want to know about it. Also, when you've pushed out a baby, your pelvic floor can not act as well for a little while. Temporarily, it should get better. But it does mean some people sort of lose the sense of needing a wee. So sometimes people have to. We tell people to go for a wee if it's just been a while, rather than wait to feel like you need to, because some people just don't feel that sensation for a little while after giving birth. Would you agree?
Yeah, what we don't want to happen is for your bladder for you not to have that sensation, and your bladder to actually be quite full and be stretched, because if that happens regularly, that's when it can kind of lead to more long-term problems with your sensation and your bladder function. So yeah, some people set an alarm on their phone if they are struggling, not getting the full sensation and those kind of feelings of having a full bladder, set an alarm for every few hours on their phone just to go for a wee, just to make sure you're emptying your bladder regularly. Just going back to opening your bowels, I think lots of people really, really worry about their stitches and that they're all suddenly just going to come apart when you open your bowels for the first time after having a baby.
It doesn't happen.
It
doesn't happen.
It won't, but if psychologically it helps to sort of hold a sanitary towel on the perineal area and on where your stitches are whilst you're doing it for a bit of kind of support, then by all means that is a trick that some people find helps just psychologically, if it allows you to kind of relax and actually be able to open your bowels normally. But yeah, we promise they will not come apart. The techniques we use to do stitches mean that they're held very closely together, and yeah, that definitely shouldn't happen. Talked about going for a wee. And the important thing as well is to say that if by the time we come around to discharging you are having ongoing problems with your bladder, so you're leaking at all and it's really affecting your day-to-day life, or your sensation isn't quite come back, it's not something that you just have to put up with. I think it can't, people think, it's just very normal after having a baby, and it is quite normal, but it doesn't need to be something that is a long-term issue for you. So please do let us know, and we can refer to physios if we need to. But most of the time, I do the pelvic floor exercises, which we're all rubbish at doing, but a lot of problems can be resolved. So do speak to your midwife about pelvic floor exercises as well. It is something that it's perfectly safe to do from any point after having a baby when you feel ready to. And really important, no matter what kind of birth you've had, so even if you haven't had a vaginal birth and you've had a cesarean, the weight of your bump in pregnancy has still put a lot of pressure and strain on your pelvic floor. If you think of your pelvic floor like a hammock, and then when you've got your baby and your uterus pressing down, those muscles kind of start to take the strain a little bit. So it's really important no matter what kind of birth you have. And again, it's one of those things people think, think about the pelvic floor in 20 years' time, but that's often the time when actually the repercussions of not doing pelvic floor exercises will start. So we appreciate it's the last thing on your mind after having a baby, but still very important.
Yeah.
It's a good app, the Squeezy app, for us to send you little reminders to do them. Yeah.
I have met women who don't know what a pelvic floor is. We all assume that everybody knows, but that's not true actually. So please, if you're watching this now and you're pregnant, please look into it now. Ask about them now. Don't wait till after you've had your baby.
Well, we don't talk about it in school. It's not really part of education. Well, it may be now, but part of health education for girls in school. It'd be good if it was, and if it is, great. But yeah, so it's quite normal if you don't know what it is. That's, not necessarily something you've ever been spoken to about until you've had a baby. Totally fine. Yeah.
Trying to find one that's a little bit less
Rubbish.
Let's do this one.
Yeah.
Mix it up a bit.
Yeah.
Rush of love. So.
Yeah.
Yeah, why not? And your heart. No, I'll put it in there. There we go. I mean, Kate does look like she's has that, doesn't she? So this is literally a hormonal thing that can happen when you have a baby. It is a big burst of oxytocin, the love hormone, that can make people feel that overwhelming urge of love for their baby once it's born. It's not always there, and that's okay. It's not always there straight away. That's all right. But it is sort of something that's built into us so that we're prepared for this hard task that's about to have a baby. So even though we're tired and just been through a lot physically and emotionally, it sort of is there to protect us so that we can deal with it well. But it's okay if it isn't there straight away. Not everybody gets that. Lots of people have births where actually the hormones are taken away, covered up in actual fact, so it can take a little longer. So if you don't feel that massive urge of love straight away, that's okay, and it doesn't mean you don't love your baby or care. It will certainly come in time.
Same for dads.
Yeah, exactly.
Partners in general, birth partners in general. I think often because they haven't been through that physiological process of giving birth, so they don't naturally have those hormones within them doing their job, it can take a little while longer for partners to start to have those feelings of love towards their baby. So yeah, also totally normal.
Yes.
That's what I was going to say. I was just going to say, because you're feeling all this oxytocin and this kind of rush of love towards your baby, it can make you feel very protective, and also make you feel quite worried, I think, because you're just wanting to protect them so much, and babies do like to kind of make strange noises in the middle of the night or in the middle of their sleep, and they have this thing called a startle reflex, and they kind of throw their arms up in the air, which is really normal, but when you haven't seen it before, it can be quite scary. So I think we get a lot of, particularly first-time parents, feeling like they have to kind of be watching their baby all the time, and they feel the need to because they want to protect them so much. So there's quite a normal feeling, and usually we do start to relax and feel like, actually, I can take my hands off for 10 seconds. It's okay.
Yeah, exactly. And it's a phase that we know when we're watching it is going to. Yeah. The mum and dad are soon going to become experts in this particular baby, but they can't imagine, not having us there to advise them and things like that. But it happens for everyone, and it makes you a normal mum and dad who care and love their child to be a bit worried and anxious, especially with your first baby. I couldn't believe someone was letting me take a baby home from hospital all those years ago. It's a big deal, but you sort of fall into the parenting role and find your own way. Absolutely.
Yeah.
So yeah, it can feel overwhelming. Should we put this one on here?
Yeah. I suppose that's for both.
Yeah.
In the middle of both of them. Yeah. And we're probably going to have loads of questions, and that's great. We like people to ask questions and write them down, because we'll come on to it, but you're probably going to feel quite tired. Newborns tend to be quite nocturnal. So yeah, if a question comes into your mind that you think it's not urgent, but I'd like to ask it at my next postnatal appointment, make a little list, bring it in with you. We're very, very used to that. And often it's partners that are in a better state of mind to write those things down, and remember to ask them at appointments as well. Sometimes they're feeling, they haven't just gone through the birthing process, feeling a little less tired, but not always. And no question is too silly, we promise. We've probably heard it before, but if not, it's absolutely fine. We don't want anyone sat at home worrying. We would rather you ask the questions. Absolutely.
So sometimes I do someone's first visit and they're sort of buzzing, they're over the moon, they've had a wonderful birth, or not, but they've got their baby and they're so in love with it, and they feel great and full of energy and stuff, and I'm sort of thinking, oh, please do some resting and eating and things. And anyway, a few days later, then this can happen, say around maybe day 3. I'm going to put it on here. And this isn't just because she's probably tired and sore in lots of different places, but actually something hormonal is happening again, which we touched on briefly earlier about the milk coming in. But it's a massive hormonal change when that happens, and this is often when people can get sort of quite tearful. And they often don't know why. Like,
I don't know. Crying at random things that you wouldn't usually cry at. Yeah.
We get that all the time. I don't know why I'm crying. And that's okay, and that's fine. And can be a bit sort of up and down, but certainly that day 3, it's very, very common to be rather emotional. The baby blues, you might have heard of that. So that's often when it sort of starts. If not already, and it is a normal process. A lot's happened in your life. You've just hormonally, yes, but also you've just been through a big thing, which is birth. It may not have been what you thought it was going to be, or it may have, but it's still a big deal. Also, having a baby is a huge deal. Your life's completely changed, and you're semi-mourning what used to be because your life is different now. So it's completely okay not to feel on top of the world. And that you might think that lots of other people are when they've just had a baby, but it's actually really rarely the case. And I get people say that to me, that so and so seems to be coping so well.
Social media.
Yeah. And lots of people want to give that impression, don't they? People are embarrassed to not feel great or a massive rush of love or whatever, but actually no one's happy all the time after they've just had a baby. That's a very unlikely thing to happen. So don't look at other people and think that they've got it better or that they're coping better than you, because that's not the case.
And then usually, eventually, once the hormones have kind of settled, you come out the other side of that kind of maybe feeling slightly irrational at the things you're crying at or not knowing why you're upset. And what we would like to know about is if a woman feels like she's persistently feeling quite low and she's kind of come out the other side of those hormonal changes, but yet she's still feeling quite low and it's affecting her day-to-day life. And the same with anxious feelings and worrying thoughts. Obviously, like we said, it's very, very normal to feel nervous and worried and have anxious feelings when you're doing something, particularly for the first time, but any time you take a newborn home. It's when those anxious thoughts kind of start to spiral and your ability to rationalise them and keep them under control isn't as great, and they kind of are overwhelming your day and really affecting you. Everyone's going to be different at the kind of different levels of things that they can tolerate, but if they're really affecting your day-to-day life and your ability to kind of function normally, and you're worried about your mental health, please do tell us, because it's, for some women obviously those feelings do stick around for a bit longer, and I think things are definitely much better now in terms of mental health care, and postnatal depression and postnatal anxiety are spoken about much more widely. We kind of have better services for dealing with it, and it's no longer this kind of taboo subject that unfortunately it used to be. And you hear the term postnatal depression a lot, but postnatal anxiety is also a thing, and I think people think that it's normal to feel worried all the time, but it isn't necessarily if, like I said, it is affecting your day-to-day life and it's overwhelming you, the level of kind of anxiety you're having. So it's, that's also a thing. It's just not talked about as much, and we would like you to tell us, or tell someone that you feel you can speak to. And often we discharge women at around kind of 10 days to 2 weeks, and sometimes these things don't set in until much later than that, so you might feel a bit in limbo as to where to go to get support, but your health visitors are there to support you with your emotional and mental well-being. The GPs are great as well, and they're often a first kind of stepping stone into getting further support if you feel like that would benefit you. So we really do encourage people to reach out for help if you feel like actually you would like some.
You wouldn't be alone.
No,
and also, we don't have to discharge people at 10 to 14 days. Sometimes we do keep people on longer, and that's because they want to, or we think that
benefit from it.
absolutely, so we wouldn't just
send you off without any support. Yeah.
Exactly. So you can tell us. All right. So I'll put tired on her and him. I've got another one for the baby as well. Should we talk about the baby? So I'm just going to put a few on for baby. Tired, cold, scared. Ooh. Hang on, somebody hit the wall topping. I'm doing very well. What does it say? Scared. Hungry. I wanted to put that one on last, really. There's loads we can stick on there, really. Also hot or lonely. Basically, they're all the reasons baby might feed. So not just being hungry, okay? That's what we're trying to get through here. Babies feed for lots of reasons. It's not just because of their actual appetite. It's normal for a baby to feed because they're cold. It's an easy way of getting to be held straight away and therefore getting warmth. Skin to skin in particular is a great way of keeping baby warm. Or if they are too hot, actually skin to skin regulates their body temperature as well. But babies let us know if something isn't right, and usually the way to treat it is by feeding it. So we've got tired, scared, cold, hot.
Sometimes sore, depending on the kind of birth you've had.
Exactly, yeah. Babies can be a bit sore or in pain themselves. Sometimes they can have some bruises and things like that. So breastfeeding acts as a painkiller to them. Yeah. I know there's so many. I don't know why I can't just list them. Yeah. If they're wet down below or just need a nappy change. Yeah. It's
overstimulated sometimes, too much going on.
Exactly, just need some calm and some cuddling. So what we're trying to teach you here is that you can't spoil a baby, basically. You can't give them too much love. Nothing bad will happen if you hold your baby or feed it, okay? You can't overfeed them breast milk anyway. And you can't give them too much love, okay? You're just teaching your baby that they're safe and secure and you're going to look after them. So it's just trying to change this idea that people have or may have, from family members or whatever, that think babies should be fed every 4 hours or or they are spoilt if they're picked up when they've just been fed. That sort of thing, and they can't be spoilt, all right? So we've learned through research and stuff like that actually, as children grow up, actually the way they have been taught to have security is by not giving in.
Positive kind of reassurance.
Exactly.
That you're there.
Yeah. It's by dealing with their needs. Yeah. So when a baby cries, actually, you do pick it up and feed it. So it's reminding you that that babies don't just be fed because they're hungry. Something I always say to parents as well, actually, who've, when they are coming in and you can tell they've had a hard night, can be a bit tearful and stuff like that, and they say they haven't slept and what are they doing wrong, sort of thing. And I actually remind them that it's the way that we've evolved. If you think about when we were cavemen, it wasn't safe for our babies to sleep at night. So what they're actually trying to do is keep you awake, and it means that they're protected. So them feeding all throughout the night it's a survival thing, and it means that they're behaving like well babies that want to carry on living, basically. And so actually they can feed often throughout the night, just when you don't want it. But then when the sun comes up, it's it reflects when the tribe would wake up, and therefore they would be protected because the other adults are awake, meaning that they can be looked after by them. Therefore, it's safe for the baby to sleep, and that's why lots of babies do have a longer sleep in the morning. Do you find that? Lots of people say that. Yeah. So actually, this sort of behaviour, it makes me think, oh, that's a normal, well baby with survival skills. I like the sound of that. I know that's easy for me to say, I'm not the one getting up with it at 2 a.m, but it is more reassuring than when somebody tells me that their baby slept through the night. Actually, that makes me think, oh, what's going on here? Why is this baby not waking up and being asked to be fed? Because that's actually normal behaviour.
I think one of the most common questions we probably get asked as well is, how can we get our baby to sleep in its crib or its Moses basket? And also just to remind people that that's totally normal as well, to make that transition, and it's probably quite scary for a baby to be born after being snug inside you for around 9 months, and they then kind of come out into this busy, loud world, and they don't have that kind of security. They're used to being inside you, hearing your heartbeat and all your kind of stomach gurgling and the goings on there. So it's quite strange for them to be put down in this space where suddenly they're able to move more, and they're not all kind of snug and curled up tightly, and they're not hearing those noises. So it's really normal that transition is quite difficult, but that, like we were just saying, by responding to them when they are crying or upset about being put down, you're giving them that positive reassurance that you are there, and the more you do that, they will start to realise it's okay for me to be left here. My parents are there, they will come for me if I need anything.
Exactly.
And it's sort of just succumbing to the fact that it might be a bit of a difficult transition, but knowing that it's not likely to last forever, and that, again, it's totally normal newborn behaviour, and you're not doing anything wrong. They're just kind of wondering what's going on, probably, really. Some people find a little bit of quiet radio, some background noise, really quiet whilst you're trying, throughout the night. Some people get some white noise, that's just something, because they have been used to hearing noise. Some people kind of tuck a muslin down their bra throughout the day so it smells like you, and then you use that as one kind of to wrap them in at night, potentially. So, yeah, there's some little tricks, but often it is just a case of time, and then learning. And it's okay.
Yes. Has anybody got any questions about anything we've spoken about on here? Mum, baby, or partner?
I think we were just going to say quickly as well, because it's so normal to feel quite tired and overwhelmed and tearful, ways that you can help yourself. People really want to come round and visit you and your baby usually, but actually it's really important, if you want to protect some time just for yourselves as a family, as that adjustment period. It shouldn't be your job to be hosting people and making tea for people and feeling like you have to be interacting with people all the time when they're coming to visit you. So it's really okay to set some boundaries and say, actually, we don't want any visitors for this amount of time, or we would only like our really close family, parents or whatever, to come visit us, and use them. Get them to do something useful for you if they can, some washing or anything. Like we said, it's totally normal and okay. This is your time to relax and enjoy cuddling your baby, and if all you do all day is sit on the sofa and watch TV or films and cuddle your baby and feed your baby, that's a day well spent in our opinion. So that's what this time is for, rest and recovery. So you shouldn't need to be hosting people.
Exactly.
Other little tips, as I say, some people like to, on their maternity leave, maybe do a lot of batch cooking, freeze lots of meals before you have your baby, so you've got some good nutritious meals there in the freezer that you can have for a couple of weeks afterwards. Anything that you think is going to make your life a little bit easier in the immediate period.
Yeah. I think one of the findings from, near the beginning of the pandemic and stuff, where people really were in lockdown and not going anywhere, there was lots of rules. I'm sure it was true that there was less postnatal readmissions for babies that had lost weight and stuff after they were born. It's normal for them to lose weight to begin with, as long as it's in within a certain amount, but apparently less people were being readmitted for this during the first lockdown and stuff, and we think it's because people were staying at home and feeding their babies,
Cuddling their babies.
yeah, and not passing them around or feeling like they have to pass them around. It is something to note that with if you're bottle feeding as well, it is encouraged that you're still kept to minimum feeders for your baby. So yourself and your partner, it shouldn't really go beyond that, as it doesn't with breastfeeding. You know, it's stuck to one person, and that was sort of how it was planned to be. So with bottle feeding, we try and encourage the same behaviour. It's a really good way of bonding, you know, with bottle feeding and breastfeeding. You're close to your baby, you can look in each other's eyes and stuff. So it's meant to be something that done with the parents, I guess. So yeah, sorry, veered off there a little bit. But we have, yeah.
Oh, no, we were just going to talk about partners, I suppose, and ways they can help, and then we'll answer questions. Is it?
Yeah. So sometimes, I didn't actually put this on here, but partners can feel a bit helpless sometimes, can't they?
Yeah. Like they're not quite sure what to do in order to help the woman after just going through birth.
Yeah.
And that's quite the normal feeling. And it's just being reassured that there are tons of things, and they probably sound like really simple things, but
I think they often don't realise how much they are helping, actually, a lot of the time.
Being there as a source of support and a sounding board when you want to get something off your chest, and
exactly
acting as a team. Yeah.
They can, you know, if the mother is breastfeeding and they don't feel like they can help with feeding, it doesn't mean they can't change nappies afterwards. It doesn't mean that they can't help with feeding the mother, you know, when she's sat there for a long time. Lots of snacks and drinks. Yeah. There is certainly ways in which dads can get involved.
Skin to skin.
Yeah, exactly. So they still have that sort of bonding and everything.
Yeah.
Also, they may well be up as much as the mum at night, but they may have had a little bit more sleep and therefore better at remembering things. You know, they can help with the lists of questions to ask the midwife or at their next checks and things like that.
And with, you know, if you are breastfeeding as well, often we really encourage partners to come to appointments where you're getting breastfeeding support, so we can explain to them signs of effective feeding and a latch to look out for, because then it's teamwork, and sometimes a woman can't actually see herself as well in the position she is, whether she's quite got the latch right, but, you know, partners from an external angle are able to tell. So it's, so you both have the knowledge and it's teamwork and you know what you're looking out for.
Yeah, we can be really, really helpful with that, definitely. Questions. Unless I'm getting it very wrong, there's no questions about that. So, someone hello Rachel, she said, hello, I'd like to ask whether this birth centre will reopen again to give birth soon.
Mm-hmm. So, we have heard today that they're really hoping that we will be open again as of Monday the 11th. So obviously it's been a really frustrating situation for lots of women who were planning on birthing here, and obviously for us as well, and missing being able to provide that for women. But unfortunately, because of staffing, you know, across the whole trust, we've had to make our services as safe as possible, which is why we've had these changes. But we've had news today that feeling fairly positive that next Monday hopefully we'll be able to reopen again. So that's where we stand at the moment.
Yeah.
It's certainly not anticipated to be a very long-term thing.
We're very much looking forward to it too.
Yeah.
And I'm sure the first thing that will happen is we'll put it on our Facebook page as well, so people are aware. You know, we want people to have their first choice in you know, birthplace and stuff. However, I want to assure people in between who may go into labour and are planning to come here, or any of the other maternity midwifery-led units that are closed for birth for the time being, that there's been many women that we've looked after who were planning to come here and have gone elsewhere and have had great births and positive experiences and stuff, despite the fact it wasn't their first choice, you know. There's been people in my caseload that have gone to the Horton and been really pleased, or gone to the stayed at home. Some women have instead, and they never thought about it and before, and had great experiences, and also gone to the Spires as well, and you know, got in the pools and stuff, which was their main thing that they wanted. That they are still available in other places, but yeah, we will let you know when we're open again, for sure. Let me just see if there's anything else. Thank you, that's great news, fingers crossed. Yes, we hope so, Rachel. Hope to see you in the future. Okay, I don't think there's any more questions.
No, fine. Okay, perfect.
Okay.
Well, answers everything from us today, and
So-
hope you will.
All right, thank you.
Bye.